All right, thank you so much. So I'll be talking pretty quickly about EMR efficiency. I went into like a deep dive during residency about this, and now that I'm starting as an attending at two different places right now in San Diego, I've been learning about Cerner and Meditech as well as Epic. So I've gotten, I think I like Cerner more, but we'll get into the reasons why. I have no disclosures, obviously. And then just like a quick intro about me. I'm in San Diego. I recently just graduated in June. And it's been great. I love being an attending right now. It is very stressful though, and I'm very thankful for my co-residents. So some of the girls and I have like a curbside consult chat that we always send EKGs and weird stuff and ask for advice. And it's great because we have everyone on each coast and as well as in Texas. So it's just been a really good experience. I currently work in a level one trauma center, similar to a hospital center, with residents. And then I also work at a single coverage emergency department in Chula Vista. So very different styles. Both require you to be very good at using the EMR. So just a quick roadmap of what we're going to do. We're going to have a quick introduction. I'm going to go into like the smaller details and hopefully help you build that into ordering stuff for patients as well as documentation and using Teams. So the first part is the introduction. When we think about being a doctor, being a healthcare provider, we always think that we're, at bedside talking to patients. But in reality, we're often sitting and documenting, and that takes a majority of our time. Um, there was a study in the past that was done studying residents as well as attendings. I think there were about like 6 residents, 7 attendings over the course of 17 shifts. This is at a busy tertiary care center, and about 78% of the patients popped up some kind of alert, and on average is about 3.5 alerts per patient, and each alert took about 7 seconds. And that's not including like how much clicking is involved for each patient. There's a lot. We know there's a lot. So just looking into like the pop-ups, there's a lot, and it turns out that a large majority of them don't really change clinical management. Only about 2.3% in this study show that it changed clinical management, whether that was allergies or contrast, etc. So a lot of the alerts that we do get through the EMR don't really change our management. So how can we circumvent like getting all these alerts and getting only the important ones? Um, so there are two big players in the EMR world. There's Epic, there's Cerner. These are always going to be the ones that are rising. And you could see that when you do chart reviews, you'll get access to a lot of different systems if they use these big players. I unfortunately use Meditech. It's terrible, but there are other different EMR systems, but these are the two main ones. And you have adjuncts with like these dictation softwares such as Dragon and Fluency. Both are great. And over time, we've noticed that we've been using less scribes compared to the past. So now it's up to us to be able to dictate as well as document in real time and get our charts done. So the first thing that I'm going to go through is dot phrases because this is essential to building your larger documentation. If you want to join along, you're welcome to. This is how you get to remote access. So um, I'll get into later stuff about launch point orders, and I think that's the highest yield. But this right here, you could join along if you want to help make your own dot phrases. So I want to show like how we interact with our EMR system over time. So we have a patient walks into ED, they get registered, you review their history, you see their chief complaint on the launch point dashboard. You could also receive sign out from your colleagues and have to write a note as well for handoff. You document the history of the exam. You start ordering stuff either before, during, or after you see the patients. And then you start adding your reassessments, documenting that, and reaching out to your consults. And then afterwards, hopefully, you can figure out a dispo and you can put the dispo order in. So the first one we're going to start with is the beginning, your interaction when they first come in. And a lot of it is like getting those sign out notes done because for me, it weighs a lot on my stress level is like how many sign outs I get and whether I put a documentation note because that helps me organize my thoughts. So as far as sign out documentation, the bread and butter of like starting any smart phrase is that you need to know how to access your smart phrases. So if you go to the top and click view and then click auto text copy utility, that's where you're going to get all your smart phrases there. you can click the icon that's in the red box, and that opens up your own smart phrases that you have. And then you can start creating abbreviations. A lot of people will use their initials and they'll start typing whatever they want to have as a quick dot phrase. Um, so I want you guys to be able to separate token versus drop list. A token is something that is automated. You could put like the patient's information, so you have to be in the patient's chart. So you could get like automated information without having to type much. So you can put in a token for age, gender, MRN, last name, and first name, and we'll get into this when you start messaging consults. And that's a big time saver. While you could create your own drop list, doesn't have any patient information, but as you keep entering each list item, you could really build a list and you just click it when you enter that smart phrase. So I use a drop down list for like the names of ED physicians that are signing out to me or I'm signing out to, for residents, plans, and dispositions. So I have an example here. So for example, if this is my sign out, I got sign out from Dr. Goyle and Dr. Doris, who's a resident. You can put like dot time and then put like this patient was signed out by Dr. Goyle and Dr. Doris, and you could have your own drop down list for that. And then pending CT imaging, you could have a drop down list for that. And then you could have some stuff automated. So I usually like to put the age and gender as and then start typing like their history and then what the plan is. And then you could, of course, have ED course already prepped to go and then have an area for disposition. And then one thing that I like to do for any of my patients is put in .ed dispo, because that will put the discharge order in, what time you did that, what diagnosis, what medication, and where they're going. So I really like that to like clean up my note and have a quick summary at the very end. Um, and so again, like you could have these drop down lists that have different names and you just click on them. Some of them you could have it automated as one line item, or you could just keep it blank. I would recommend keeping it blank, but it's easier to have this drop down list versus dictation, because some people's names are very hard to dictate or type. So it's easier to just do a quick click through. As far as like disposition or plan, I put like CT imaging, labs and reassessment, x-ray, etc. They're very vague, but I go into more of that later in my sign out note. And it's just a quick summary. Going into orders, this is the part that I really want you all to focus on because it has changed my efficiency, especially my third year of residency. Well, you already know how to do history and exam and document that. Everyone has their own smart phrases, but the ordering is like the huge thing. Oftentimes, like when you put in orders, you go to ED quick orders, but some people are able to utilize their launch point so that in the front, when you first click on a patient's name, the quick orders off of launch point without opening the patient's chart fully, you could see a list of common medications that are used. But in actuality, you could customize this so that you could put fentanyl, or you could put morphine. Bentyl is one that's not going to be on there, but you could put on there. You could put your migraine cocktail. And so not only is this tab available for just medications, you could put it under labs, you can put it under EKG, radiology, patient care, and consults. And that brings so much room and space for you to organize all your orders. And they don't have to be just meds or labs. It could be like order sets. It could be like nursing communication orders. It could be discharge orders. So this is a huge game changer. And if you don't have it, you need to have it. And the way that you start setting it up is that you go to orders after you open a chart, and you're going to only have to do this once, is open up the chart, click orders on the left-hand tab, click add at the top, and then you'll see that you're already on the home page. And then you would want to click the star. The star is going to have like the drop next to it to do organized favorites. And you want to make all these different folders here that start off with launch point. So that's launch point medications, launch point labs, imaging, patient care, consults, EKG. You're going to have to type it exactly like this, or it's not going to recognize when you start organizing and putting orders into these folders. So you click organize favorites, you open it up, and then make sure to put your mouse and highlight favorites at the top, and that's when you can start creating folders, because you need these folders to be directly under the favorites tab. So you can see that I already created some of these folders, and if you want, you can take a photo of this screen because this is how you type it. And then there's no launch point vitals, but hopefully one day there will be. And you start titling them and name a folder right there, and then you click close. And I want to thank Nam Tran, he's my co-resident. He's the one who figured out how to type things exactly so that you can have your orders under each category. So thank you to him. Um, and so now that you have your folders created, I want you to click on any patient encounter and then go to ED Quick Orders. So for this one, I'm starting on like organizing and putting my favorite labs I like to order. So I started clicking them. You don't have to click them in any particular order. You can organize it later. And then I have 9 in my in basket there. Um, don't sign it because you don't want to sign these orders, but click modify details. And here you could right click it after you highlight it all and then add to favorites. And that's going to bring up those folders that you made. And then I want to put these labs that I highlighted and want to put on the front page and favorited. I want to put it under LaunchPoint Labs. So once you highlight that and click OK, you'll be able to add it on. In order to start organizing it, you have to go back to orders and click the organize favorites, and then you could click the minus sign next to launch point labs because that will help show all the labs that you have favorited and moved to that folder. And some people will have the sort favorites alphabetically already checked off. So uncheck that, and then you can use the blue arrows on the right hand side to move it up or down. So I like to cluster mine on based on like how often I use it in category. So that's also like a great way to organize all the different folders. And then you can always adjust this with time and troubleshoot it. So you could see like here, I also put stuff under EKG. So I put all my cardiac stuff or blood pressure meds. I put my cardiac dose of aspirin in here. And the great thing about this is that you could put it in and some of the stuff you could already fill out if you filled it out when you first favorited these orders. So you could put in indications for protonics, for these meds, etc., so that when you do end up clicking these orders off of launch point and signing it, you don't get those pop-ups anymore. So here are some ideas on like what stuff you could put in which category. So under meds, I put agitation meds, so my B52, my droperidol, different types of pain meds, my migraine cocktails, I put here. Labs, I have found it to be a game changer to put in blood cultures here. You're going to get it off of a peripheral IV usually. So I already have that filled out, so I don't have to keep opening and clicking all these different charts. I can put blood cultures. You could also put your stool cold, which is also great because no one wants to be ordering that after you just did the test. So you could already have that in real quick before you run out and get your stool cold. As far as EKG, I put my Lasix in here too. So I know that whenever someone's having like cardiac or pulm or hypertensive emergency, I'll go ahead and just open up this tab so I can start giving some meds. Radiology, you could also do this for some radiologists will hate you, but you could technically have some stuff pre-filled out. So you could put the most vague thing you could put is pain, but I recommend putting like shortness of breath, like concern for pneumonia, etc. And you could also put your phone number in, and that all depends on whether you saved it like that and moved it to your favorites. So you could start filling out that stuff so that when you sign it from launch point, it doesn't have a pop-up anymore. And then you can put CTPE, etc. Under patient care, you can put fluid boluses as well as different antibiotics. So I put vancomycin, vancomycin. I also put repletion meds, so all my potassium packets, MAG IV, Tdap, violet restraints. And then consults, I put all of my order sets. So I put like sickle cell crisis, blood transfusions, or code ones or code strokes. And it's been helpful to also have like the loop order and quick discharge button there already pre-filled out when you saved it. And then when nurses ask you to put in the elopement order, I just click it and then sign without opening the patient's chart. So going into Teams messaging, this is the last part, is being able to reach out to teams using the small little smart phrases that you created. So you could start putting in these tokens because it'll put in the patient's last name, first name. You could also put their MRN age, gender, and then your own drop down that you learned how to create, saying what room they're in or hallway. So, and then you can start filling out the rest. I've noticed people go back and forth in trying to write the patient's name, their MRN, their age, and just going back and forth is too much when you could just simply open the patient's chart, um, go into your note, put like dot team, and then this whole entire order set, or not order set, but like smart freeze will come up and it's already generated for you that it's going to be correct. You just copy and paste it and start typing what you need this patient to be admitted for. And this can be used not only for Teams, but also for like Care Connector, the other messenger systems that we have in MedStar. So just again, open a patient's note, enter the dot phrase, copy, paste into Teams. Um, and here you could put the drop downs as well, and that's what you make it for yourself, for your department. Other areas, and this is the best thing about EMR, is that you can get very nerdy about it. You can use it in social determinants of health. You can use it for AMA. You could do a drop down for like the amount of time you spent for critical care. You could use it for EKG interpretation or like stuff where you always have to keep writing. I personally reviewed and interpreted, etc. I also use it for consults and putting like if there's only a few consults, like putting the attending's name as well. You could also use dot phrases for discharge precautions. I've also used it to have my own dot phrases, and because sometimes you forget how many you've made, so I'll have a running list that I keep adding onto. I'll just put dot phrases, and then I could see which one I was looking for and delete it. Um, and the more you know, you realize that you can put a dot phrase within a dot phrase within a dot phrase, and you can also start using Dragon to as and dictate your command for a smart phrase. So there's so much you could do with EMR. You just have to be very creative with it. My takeaway points is that you use EMR every step of the way. You can use it to minimize pop-ups and less clicks, and you could also use it to order things faster. Make sure you know how to use or make drop lists and smart phrases. Get creative with it. You can always delete it and try something new. And when in doubt, YouTube has a lot of Cerner videos, so you could always use that. Don't really have much references. And then this is just like my guide that I made last year if you want to have like a quick overview again of how to make those launch point orders.